Okay, I'm back. Dr. B here, Mariel Paralitici Morales, waiting for Dr. Taiwo to join, which is good because she has a last name like mine, pretty complicated, so I do have to read it out loud, which is Durowade. Here she is. Dr. Taiwo, just send me a request. I am unable to send you the invite. I think it's better. Here it is. Are you around?
Sorry.
Yay, no, it's okay. Hey, I'm used to this. It's part of it already, and I am actually enjoying every single blooper, I guess. It's not a
Trying to
blooper.
see
It's
how
just
to get
happened to
this
everyone, believe me.
to see
It's
steady. Sorry.
thank you. No, please don't be sorry. It's part of it, part of the package, right?
So that you can see my whole head.
That's another thing that I tend to take a lot of time, like with the
Yeah.
camera moving around, and I'm like, hey, just turn it on.
Let's try it this way. Oh, I'm so sorry. This is okay.
Okay, so it's 11:03.
Mhm.
I am going to start, and I am very happy to have Dr. Taiwo Durowade here with me today. Before I do introduce her, I am Dr. P, Mariel Paralitici Morales. I am an adult, child, and adolescent psychiatrist practicing in West Palm Beach, Florida, and serving Florida, as a whole. I do provide both telehealth and in-person visits. So we are here today in our regular Friday conversations with Dr. P. And today's topic, it's a very common topic that come up in my practice. I see all range of kids and adults and young females, and it is a topic that comes often. So who better than Dr. Taiwo to share her expertise and wisdom of gynecology here. So here we go. Dr. Taiwo Durowade is a board-certified obstetrician gynecologist who has been practicing in the South suburban area of Chicago for the past 5 years. After finishing her training both in Chicago and then later in Michigan, she returned home to the South suburban area of Chicago to provide personalized care to the woman she wanted to serve. Women with whom she could relate and whose issues resonated with her. Dr. Durowade is interested in preventive medicine because it helps women live healthier lives. She started her own private practice, gynecologic practice, in January 2022, Dardur Gynecology, in order to better achieve this goal. Dr. Durowade believes information is a key, me too. She enjoys educating her patients, which is why she created a show titled Uncommon Knowledge on her YouTube channel. I'm
Thank you.
so proud. I haven't done that yet, and it's there. I am gonna do it. Where she shares information about that should be common but remains uncommon with her subscribers and the social media community at large. Dr. Durowade enjoys traveling, spending time with her family, and watching K-dramas. So thank you again, Dr. Taiwo. And I'm sorry, I'm going to just say Dr. Taiwo. You can say Dr. Mariel. I'm used
That's
to it too.
okay.
Um, I just want to know more about, and you helping us to understand better our, as females, and our bodies or our hormonal changes. And I always talk to my patients about how we can be a full spectrum of emojis in one day. Like
Hmm.
that's us. Those are our, we can go through so
Hmm.
many emotions in a
Hmm.
day that, and it can be normal to it. Everything
Hmm.
has not to be
Hmm.
abnormal. So, I would say first, if you want to tell us a little bit more about
Hmm.
you before I start asking you more specific questions, but I really would like to start with the normal, natural changes.
Hmm.
premenstrual and menstrually when we are, starting our puberty all the
Thank you,
way.
Dr. Mariel. It's okay to call me Dr. Taiwo. It's easier.
Definitely.
Thank you for the opportunity to be on your platform. This is, it means a lot to me. I really appreciate it. Thank you for that awesome introduction as well. As you said, I'm in the South Suburban area of Chicago. I have my own private practice, Dado Gynecology, so I'm only seeing gynecology patients at this time and taking good care of them. So I see the same things that you mentioned. A lot of people come to me with hormone imbalance. A lot of people, people are on social media these days, and everything on social media is trying to sell them a supplement for a hormone imbalance or something. And so people come to me and say, I want to have my hormones checked. My hormones are imbalanced. I feel this and this during my period. So um, when we start, puberty is when the brain and the ovaries start communicating. The brain starts telling the ovaries, wake up, start making eggs. Well, no, start growing eggs. We are born with all our eggs. We lose half of them. We lose about half of them. So let's say we're born with 1,000,000 eggs, and by the time we're in puberty, we're 500,000 eggs. This is all women. And so by the time you start releasing, your eggs, your brain is telling your ovary, mature an egg and release it. Anytime we mature an egg, our estrogen level goes up. So at puberty, that process is not very streamlined. That process is very confused. So we call it an immature brain ovary communication. So a lot of teenagers will have like irregular periods. Maybe they have a period this month and then it doesn't come for 6 months, and they start getting worried. That's very normal within the first couple of years, 2 years of puberty. But by the time, after 2 years, we expect that process to be developed, to be mature. And the process is that your ovary matures one egg and releases that egg. As it's maturing that egg, estrogen level is rising and rising and rising. And then when estrogen level peaks at the highest level, then your ovary basically releases the egg. And it sort of happens like a balloon bursting. Not the ovary bursting, but the egg where the egg is stored bursts to release the egg. So that's when the estrogen is very high. So a lot of people might feel physical symptoms when when that egg is released. A pain in one side of their pelvis. Either you release it from your left or release it from your right. So you might have pain on one side. And then, like I said, your estrogen level is rising. You may have breast tenderness. You may have increase in sexual desire, actually. People's libido rise as their estrogen rises. Yes.
So, so I have a question. Because the estrogen is rising and possibly
Mhm.
reaching that peak, and all these possible
Mhm.
physical symptoms
Mhm.
start to happen, does that has to do also with a possible another factor in the mood part
Yeah.
of this shift up of estrogen? So let's stop in the
Mm-hmm. Into
physiological process so we can
the
continue to the
mood
next
process.
step,
Yeah.
but joining it with the mood part. So now the eggs are releasing,
Mm-hmm.
now this process
Mm-hmm.
happened, we peak the
Mm-hmm.
estrogen. Mood wise, what's the natural
Um,
aspect
that's
of
where I'm
this?
going, because
Okay.
once you release the egg and the estrogen
Sorry.
peaks, then it sharply falls. When it sharply
Okay.
falls is when people have a lot of the mood changes because of that sharp estrogen fall. And so people might, and then, so that's like 2 weeks from your last period. So it takes 2 weeks to mature the egg. So 2 weeks for your estrogen to rise, and then at that maybe 14th day, if you have regular cycles, your estrogen is at its peak and you release it. Then once you release that egg and nothing happens, your estrogen sharply falls, your progesterone starts to rise. And so that sharp drop and sharp rise of estrogen and progesterone is what causes mood irregularities. People are irritable. They find that they get angry easily. They find that they're more depressed. Some people may feel something. They said, one of my patients describes it as feeling rage, like very angry. It's very hard to be around people, very hard for her to communicate her feelings. everything upsets her. And that's because of the rise and fall. So it's not necessarily because one particular hormone rises. It's more because one particular hormone rises and sharply falls, and then another one sharply rises and sharply falls. Now, there are people who don't have any mood issues at all during their periods. There are people, they might just feel a little crampy. They might just feel a little moody. Everyone gets a little moody, like, oh, my period is coming. That's kind of why I'm a little moody. I'm a little angry. I'm getting a little short with people. But there are people who have significant symptoms where they can't function. Um, their family members complain that they're difficult to be around. They're angry. Some people might even have headaches with this. And so imagine you're in pain because your period is coming. You're having migraines, and you have to interact with people, and so that adds to people's mood irregularities with those hormone rise and fall. Now, when people get to menopause, the other side, the flip side of it, where the ovary is shutting down and they're not making those estrogen rises and fall, it's just all the hormones are falling. Estrogen, progesterone, testosterone, all the hormones are falling. They can also get mood problems. They can get more depressed and more anxious. So newfound depression and anxiety can develop in menopause when the ovaries are shutting down and you don't have your steady rise and fall of your hormones. So menstrual cycle, the rise of estrogen, drop of estrogen, rise of progesterone, drop of progesterone is what causes mood changes. Menopause, the fall of all your hormones is causing your mood changes.
So now going, to the next question, which is related to here. You mentioned you have a patient that
Mm-hmm.
that she told
Mm-hmm.
you it's already affecting her life in a daily basis. She gets angry. She just cannot be
Mm-hmm.
around people. Possible
Mm-hmm.
feelings of rage. When
Mm-hmm.
you encounter a patient like this, are you already thinking about,
Oh
oh,
yeah.
this might be a PMDD case, or should I
Mm-hmm.
refer to psychiatry to make sure I'm not missing anything? Or, because I've had both ways where immediately I get the patient with the chief complaint of mood swings and very related to my
Mm-hmm.
menstrual cycle. I'm already, thinking about PMDD, PMS. I'm ready to make my
Mm-hmm.
evaluation, but I need to make it very thorough. So when I do feel that this is possibly PMDD, premenstrual, you
Mm-hmm.
as a gynecologist, do you think that it should be a
Mm-hmm.
psychiatrist um,
Mm-hmm.
managing this patient, or because we already rule out and psychiatrically the psychiatrists tell you, "Hi, Dr. Taiwo, thank you for the referral. I do feel this is more a hormonal real PMDD type of case." Would you continue treating, or would you completely refer, or how would you be, what
Mm-hmm.
is your
That's
approach in
a
these cases?
Yeah, that's
Because I've
a
had
great
both.
question. So, when people come to me and complain of these particular symptoms, and we find out that it's only happening during their menstrual cycle. So I always make sure to find out, do you have these symptoms outside of your menstrual cycle? So when you're not on your period, are you a happy person? Does your family have any complaints about your interactions with them? And so when we find out that it's just during their periods, then we come up with the diagnosis of PMDD. PMDD is premenstrual dysphoric disorder. So is different from PMS in that premenstrual symptoms. Premenstrual symptoms are you're moody, you're crampy. People are like, oh, she's on her period, it's okay. But PMDD is when it's a disorder. It's really affecting your ability to function. And so those patients, my first question is, do you have a therapist? That's my first question. Do you have a therapist? Because,
Yes,
what I
yes.
can do is I can explain to them this is happening because of your hormonal shifts during your period, your rise and fall of estrogen. And for those patients, I can either put them on birth control. That way, they have a steady estrogen progesterone. So the ovaries are not releasing an egg. The ovary is not rising estrogen, dropping estrogen, rising progesterone. They just have estrogen, progesterone steady on the pills. So we quiet down the ovaries, and that can work for some people. I have a patient that's all I did for her, and that was all she needed. But I have this other patient who cannot take birth control pills. You know, there are people, they can't take it. They have high blood pressure. They have all these conditions that put them at increased risk of blood clots and high blood pressure if you put them on birth control pills. So those people, I do feel comfortable starting them on a low dose antidepressant. And what they like about it when I tell them is that, you know, you take it the week before your period is about to come. So you have to track your periods. So it's not when you start feeling the symptoms. You start it before you start feeling your symptoms, a week before your period. And if the symptoms go away when you start having a flow, then you stop the medication when your period starts. So people are more amenable to antidepressants when I tell them you only have to take it for 1 week during your menstrual cycle. But I always say, do you have a therapist? Because I
Yes.
can't handle the other parts.
Hmm.
You know, I don't know how to, I can give them some coping mechanisms, but that's not really my specialty. So I always make sure that
Yeah,
people with
agreed.
PMDD that's affecting their lives, and you know, how to go up on the medicine. I don't want to be the one managing that. I want your psychiatrist to say, okay, we need to increase your Zoloft or we need to increase your dose. So I can start you on it, but I will eventually defer to a psychiatrist. Now, if the psychiatrist feels like this is PMDD, you can go ahead and manage it, then I just titrate the dose up a little bit. If I'm going higher than, I'm comfortable with 25, 50, like the low doses. If someone is requiring higher doses, then we're missing
Hmm.
something. It's not PMDD and I'm missing something. And so I would refer them back to their psychiatrist. I'm comfortable starting low dose medicines that are working, but if it's not working, then maybe we need to circle back to the therapist and the psychiatrist to figure it out.
Agree, agree. I think that that
Oh yeah.
multidisciplinary care and management it's
Yeah.
important just to be on the same page. It's not about I found a lot of like, ping pong game about specialists sometimes like, no,
Hmm.
you treat it, no, you
Yeah.
treat it. Hey, let's just talk about it. And I think that's the best way
Hmm.
when we are in the same page. And we are really into
Oh
the
yeah.
best interest of the patient. That's we
Absolutely.
are gonna make a
Yeah.
change. I can guarantee that. um, so I had a
Hmm.
few thoughts in my mind when you were mentioning about
Mm.
the OCPs, and I'll go, back and forth in terms of the few questions. So, when would you consider the oral contraceptive will be more for heavy flow or for that type of irregular menstrual cycle?
Yeah.
Because maybe in the past, I know there's many
Hmm.
new oral contraceptives in the market. And correct me if I'm wrong. I'm really not
Yeah.
using data. I'm just giving my opinion. There is a lot of new agents that are are mixed with other agents that are more
Mm.
directed to the mood
Mm.
also. So I
Mm.
believe there are. I'm not sure. That's why. Let me mention something for out of my head
Mm.
because there is
Mm.
one called
Mm.
Jasmine or so. Okay, so I like many of the many years ago, I heard a patient telling me that her doctor started her on
Mm.
that particular one because it does
Mm.
targets the mood and it
Mm.
prevents the mood to go kind
Mm.
of wild. I do have other girls that starting regular OCPs, their
Mhm.
moods really gets very
Mhm.
affected, so they cannot take it. So it is like but it is a direct association of the just use of oral contraceptive
Mm. Mm.
regardless
Mm.
of
Mm.
PMDD, PMS or PMDD, to
Yeah.
in
Yeah.
regards of the mood as a
So that's
treatment.
great question. So it's two ways. Someone comes to you for heavy periods, and then you start them on pills, oral contraceptive pills, and then it affects their mood. Or someone comes to you for
Mhm.
mood symptoms during their periods, and then you start them on oral contraceptives to fix their moods. So it depends on the what the current period looks like. So if someone comes to me and says, during my periods, I have a lot of um, this is without birth control. This is without any kind of contraceptive pills. If someone comes to me and complains of breast tenderness, nausea, dizziness, vomiting during their periods, those are progesterone effects. So in someone like that, if I was going to start her
Hmm.
on birth control pills because her ovaries are making, she's very sensitive to the effect of progesterone that her ovaries are making, then I'm going to put her on a birth control pill that has low progesterone. I'm not going to put her on something like Yasmin that has high progesterone that will worsen her moods and worsen her nausea. People used to do some of the Yasmin because they help with acne. And so people will come and they would start people on acne because of those, but those have really high progesterone levels in them. And so if that patient is already sensitive to her own natural progesterone, already during her own regular periods, she has moodiness, she has breast tenderness, she has nausea, she has dizziness, that's telling me, oh, she's sensitive to progesterone. So if I'm going to choose birth control pill as an option for her to quiet down her ovaries, I'm going to choose a low dose progesterone one. And so that's kind of how I help people with, choosing the birth control for them. If it's just heavy flow, then heavy flow, we know progesterone will help them with heavy flow. But if you tell me heavy flow but moodiness, then I go down on the progesterone. So you have room to play with the pills. But there are people that have PMS or PMDD, and I see that they have an IUD. The IUD does not affect your ovaries. Your ovaries will continue to ovulate. Your ovaries will continue to release estrogen and progesterone. The IUD will make your periods less. The IUD, especially if you use a progesterone IUD, will make your periods better. I love IUDs, but it doesn't affect the ovaries. It does not touch them. And so it's
Yeah.
not going to fix PMS symptoms or mood symptoms or affect mood symptoms during your period. So that's why we talk about for people who are moody during their periods, for people who have really severe mood symptoms, birth control pills would be my first choice because, I'm a gynecologist. That's where I specialize because then I can quiet down the ovaries, the up and down of the ovaries, and just give them a steady state of estrogen and progesterone. There's some birth control pills that try to mimic what the body does. So there's a different hormone, different amount in week 1, different amount in week 2, because remember I said the progesterone rises. And so that birth control pill is trying to mimic it by increasing the dose of progesterone each week. I don't put people who have mood issues on that because you're mimicking what the body does. We don't want to mimic what the body does. That's what's causing their symptoms. We want to give them steady state estrogen, so same dose. So the pills that have, we call them monophasic pills, meaning same dose of estrogen, progesterone every day for the 3 weeks, and then they have their period the 4th week. And so birth control pills, people who already have sensitivity to progesterone during their regular periods without any pills, people who are moody, nausea, headache, fatigue, can't get out of bed, those people we don't we don't give them high progesterone for their birth control pills. And like I said, if birth control pills is not a good option, then we do an antidepressant just the week before their period, and then they stop it when the period starts, and that usually solves the problem.
So, couple of comments here. This is so, so good. Thank you, because even I'm like, oh, so I can even understand so in a simple way. The other question was like, do you ever plan to move to Florida? I would love to have a doctor like you. So like I feel like, oh my God, the way she talks, the way
Thank
she
you.
is like amazing. So thank you for your for
Thank
you the
you.
way you really say things, because it makes it more like,
Mhm.
oh, it's really that's what's going on. It's like, yeah. So learning point from the whole thing that you just said, what I got it out of it, it's like really the oral contraceptive medication choice will be based on those symptoms that are being a problem for that patient, and that way you are like in your mind, okay, okay, no, this is progesterone, I
Mhm.
cannot use this one, I have
Mhm.
to use that one, I have to use more. So that's how we are like
Yeah.
doing our evaluations, and at the same time like doing all this crazy puzzle. Okay, now she means this, da da da, she's this, she's that, and at the end it's like from
Right.
the 100 oral
Right.
contraceptives, I believe this is the one that will be better for you
Right.
because A, B, and C. And I love that. Now
Mm-hmm.
going into the SSRI part of it, which is where I come in, a lot of these patients goes into the SSRI part of it, and
Mm-hmm.
they struggle with the every 2 weeks I take it, then I stop it, then I
Mm-hmm.
have to count. They
Mm-hmm.
struggle. It's difficult to track our menstrual cycles. It's easy only if we are regular. So when we are irregular or
Mm-hmm.
we have an IUD, like me, I never know when I am in my period for the last 13, 14 years. And
Mm-hmm.
it's
Mm-hmm.
difficult. So how do I tell someone?
Mm-hmm.
So that's why in my case
Mm-hmm.
I like Prozac, because Prozac I just tell, hey, Prozac it's easier in the one that it's indicated and approved for the
Mm-hmm.
PMDD 2 weeks before, then you stop it because of the long
Mm-hmm.
action of the medication. You don't feel the withdrawal symptoms that you might get when you
Mm-hmm.
stop solo after 2 weeks. Then I restarted after 2 weeks. Then you are kind of
Mm-hmm.
having some sort of symptoms. So Prozac, but it's not about that, the difficulty, the challenge. It's more like it's
Mm-hmm.
difficult to track when I start, when I do know if I'm not halfway of
Mm-hmm.
the 2 weeks that I'm supposed to take it. And it's difficult. So I do tweak most of the time when they come to me on that regimen, which should be the one
Mm-hmm.
based on OBGYN protocol, because that's the right
Mm-hmm.
way your hormones are working. And that's what we're treating. But then it comes I was referred for this, and I just help them to just
Mm-hmm.
cope easier, just
Mm-hmm.
take it daily, maintain this low dose, and at some point we can practice
Mm-hmm.
again, stopping
Mm-hmm.
it and going again, trying it. And, it's just a
Mm-hmm.
matter of getting used to every two
Mm-hmm.
weeks, every two
Mm-hmm.
weeks, not, yeah, you know? Um, but that was just have you seen a patient telling you, doc, it's hard after 3 months doing this, or no, or they do it in your practice, in your
Um,
observation?
that's actually a great point. You're right in that this, the taking the medication the week before your period is for people who have regular periods. If you don't have a regular period, how do you know when your period is coming? And then you mentioned that one of my patients actually said that it was difficult for her to remember to take the pills. It's when she starts feeling the symptoms that she remembers, oh yes, my period is coming. I have to go take the antidepressant. And so,
Yeah.
yeah,
You see, I learned from you what to say when that you see.
exactly.
Thank
So
you.
you're right in that people may not know, when their period is coming, because like if you have an IUD and it takes away your period completely, then you don't know when you're ovulating. And so at that point, it makes it a little harder for me. At that point, I'd rather either put them on birth control pill. If I cannot put them on a birth control pill because they have issues with birth control pills, let's say, they can't do estrogen, progesterone, but they want to do, and I put them on just a simple low dose progesterone pill to quiet down the ovaries, but then they're having irregular bleeding with that one. Like, there's so many things that could bring someone to the point of, okay, birth control pills are not working. I can't track my period, so I don't know when I'm going to take this antidepressant. Then, at that point, I send them to you because they would need coping
Yeah. No, no.
mechanisms, and they would need either something long term that can be managed, titrated, reduced, and adjusted. And that's where you want your psychiatrist colleagues to help you with that. Yeah.
It's so good. I love all
Oh,
the
thank
info from the
you.
beginning to the end, because everything it's gold. We think we know these things, and I do love, absolutely love. I would steal it
Yeah.
from you if this world would be so easier stealing stuff. The name uncommon knowledge. I love it. It's like it's
Yep.
real. It just goes direct to the point.
Yeah.
It's things that are common,
Yeah.
but we don't really know
Exactly.
much about them, and we should make it common.
Absolutely.
So thank you for
My
educating
pleasure.
everyone out there. So I mean, I think that this is a topic, Dr. Taiwo, that we could be going and going and going and never stop because it's really, it's like a
Yeah.
woman
Woman
equals
equals.
hormones, good or bad. It's
Yes.
like, and not
Mm-hmm.
only the reproductive hormones, because people, we were just
Mm-hmm.
talking about reproductive hormones. Our body is full
Mm-hmm.
of other
Mm-hmm.
system hormonal pathways that also affect
Oh yeah.
gynecologic pathways or reproductive pathways, and as
Oh
well
yes.
as the
Oh
mental
yes.
health of us. So, and when I have to evaluate for this type of mood disorder, I have to rule out about almost everything, because almost everything in psychiatry can present with some sort of mood
Mm-hmm.
instability, dysregulation, something like that, from bipolar 1 or 2, anxiety,
Mm-hmm.
depression,
Mm-hmm.
dysthymia, you name it, all of them have those periods. So the multidisciplinary approach, it's amazing. We can get information from the doctors, from the family, from the patient, and from our evaluation, and at the same time putting all
Mm-hmm.
these puzzles together. So anyway, thank you for joining
Absolutely.
me today. Is there's any tip or
Oh
any
yeah. Yeah.
takeaway
Yeah.
teaching point that you have for
Absolutely.
our viewers,
Absolutely.
and
No,
then we
this
wrap
was a
up?
great conversation. Um, because what like you said, it might be harder for some people to track their periods, but I still recommend everybody track it because it's information that helps us. So even if it doesn't come for 6 months, I want to know that. I want exact dates. So there are people who come to me and they'll say my periods are regular. And then I ask them for specific dates, and then I'm like, no,
Mm-hmm.
they're not regular. They're 47 days apart. Your periods are not regular. So I always tell every woman to track her periods. Unless you have an IUD and you never have periods, then that's okay. But if you know you're here and there, it comes today, it doesn't come next month, it comes, I want to know those specific dates so that when you come with certain concerns, I can better know, okay, this is related to your period or this is not related to your period. So I recommend everybody track their periods. I recommend that if anything is if anything is related to your I'm a gynecologist. If anything is related to your reproductive, your menstrual, that is not allowing you to function normally in life, that's not normal. That shouldn't be chalked up as, oh, she's just having her menses, oh, she's just on her period. If it's affecting your relationships, affecting your job, that needs to be evaluated. That should not be dismissed. So I tell everyone to take those things seriously. So track your periods and don't ignore symptoms. Even if it's not reproductive, don't ignore symptoms that affect your quality of life, basically. And if you're experiencing symptoms that look like menopause, but you're not in the age of menopause, talk to your gynecologist because there's so many things we can do to help you go through that transition. So those are the tips that I have. Thank
Thank
you
you,
for
thank you,
having
thank you
me.
again. Yes, but tell me first before you go, please, where we can find you, and if anybody can, I mean, can anybody contact you
Oh,
and
yeah.
see how they can work together, or you're limited like me to the,
hmm
servicing
hmm
directly West Palm Beach, but I try put my
Right.
education through, these platforms, which I know you
Thank
do, and
you.
I thank you for that
Yeah,
too. But yeah, tell us how we can connect with you, follow you, and
absolutely.
all that info, please. And I will share
Oh,
it also
thank you.
in the
Thank you so
comments
much.
after.
So the name of my page is I'm on Instagram, I'm on Facebook, I'm on LinkedIn, I'm on TikTok now. It's Dardur. So Dadur Gynecology. Or Dadur Medical. My website is dadurmedical.com. So Dardur medical.com. I have a YouTube channel where I share uncommon knowledge, just like you said. So all topics reproductive, all topics gynecology, all topics hormones, periods, STDs, pap smear, everything is on my YouTube channel. And so we put up new content every week. And so there is a lot of cool information on there to binge on that I know people are interested in and would love to binge on. Um, I do only have Illinois license, so I can only practice in Illinois. So if you're in the Illinois area, you're in the Chicago area, Chicago suburban area, I'm in Homewood, Illinois. You can call, text send us a message through the website or through any of our platforms, and we will get back to you. And, if you just want content that will help you, kind of figure out what's going on, check out any of my social media pages. DARDUR Gynecology.
She
I
is
am.
all over the place,
I
and I
am.
love it because every time I go anywhere, I see you in the feeds, and I'm like,
Thank
oh, she's on
you.
fire.
Thank you,
I
Dr.
love it.
Mariel.
I love it. And and I subscribe. Are you going to
Yes, of
subscribe
course.
too? Please
Yes,
do
absolutely.
share, comment.
All the
Well, I'm
viewers,
talking to all the viewers that I subscribe, and are you viewers
subscribe.
going
Please
to
do.
subscribe to Dr. Dardo? Please do. And if you know someone who might, benefit from this live replay, will be available soon. And just
Yeah,
share it, like, comment, follow us. We are just here to, help one
absolutely.
person one day at a time. So thank you, everybody. Thank you again, Dr. Taiwo, to joining me. And again, this is Conversation with Dr. P every Friday. And this is Dr. P, Mariel Paralitici Morales, child, adolescent, and adult psychiatrist in West Palm Beach, Florida, serving Palm Beach County and the rest of Florida as well. Thank you very much, and see
Thank
you
you,
next
Dr.
time. Thank you, Dr.
Mariel.
Taiwo.